Welcome back to your Pediatric Dentist channel Tiny Teeth Talks. If you are new to this channel, subscribe the channel, and for details of this channel visit the bio section, or you can also check out my first video. Sorry if there is any mistake in videos or shorts. In last video we discussed for the dental age estimation method based on the age in the children and adolescents include Score and Maslow's method, Nola's method, Morris, Fanning and Hunt method, and Cameri's method. Today we will discuss the remaining methods. The first is Havico's method. Introduced by Havico in 1974, this method is based on the cross-sectional data from radiographs of the 116 to finished children age of the 2 to 21 years. It uses 12 radiographic stages of 4 permanent teeth to assess dental age. This method is particularly useful when some permanent teeth are missing congenitally. So these are the stages. Crown formation stages 1 to 6. Stage 1, initial calcification of the crown. Stage 2, crown begins to form and calcification progresses. Stage 3, crown formation continues and the tooth structure becomes more defined. Stage 4, crown formation is nearly completed with the minor details being added. Stage 5, crown is fully formed and the tooth is ready for the root development. And stage 6, crown is fully developed and the root formation begins. Then 7 to 12 root formation stages. Stage 7, initial formation of the root begins. Stage 8, root length increases and the root canals start to form. Stage 9, root length continue to increase and the root canal is more defined. Stage 10, root length is nearly complete and root canal is fully formed. Stage 11, root length is complete and the root apex start to close. Stage 12 is root apex is fully closed and the root development is complete. Okay, the procedure. First, selection of the teeth. 4 permanent teeth are selected for analysis. So we selected 4 permanent teeth for analysis using radiographs. In this example, we will use the first molar, first premolar, canine, central incisor of the left mandibular arch. Each tooth is evaluated, determine its stage of the formation using the 12 stage of the crown and root formation. Suppose the first molar, the crown is stage 6 and the root is stage 11. First premolar, crown is stage 5 and root is stage 9. For canine, crown is stage 6 and the root is stage 8. And the central incisor, crown is in stage 5 and the root is in stage 7. Then the step 3 is the calculation of dental age. We take the average of the stages for both the crown and root formation. So 5.5 and the 8.75 is the average of crown and the root stage. Step 4, estimation of the dental age. So the dental age is estimated by averaging the crown and root formation stages. So average crown is 5.5 and the average root stage is 8.75. So 5.5 plus 8.75 is equal to 7.125. So in this example, using Havico's method, the estimate dental age of the individual is approximately 7.1 years. Advantages: useful for the congenital missing teeth. It can be used even if some permanent teeth are missing. Standardization: provide a standardized approach ensuring consistency and reliability. Non-invasive: utilize radiograph which are non-invasive and widely available. Comprehensive assessment evaluates both crown and the root formation. Limitations: radiation exposure, require a radiograph which involve exposure to the radiation. Population variability: accuracy can vary across different population, and complexity require detailed analysis and interpretation. The next method is Demerjen, Goldstein and Tanner method. So in 1973, Demerjen introduced a method for estimating chronological age based on the development of 7 teeth from the left side of the mandible. This method was similar to that of the Tanner, Whitehouse and Hille, who estimated chronological age based on the maturity of the hands and wrist. Demerjen, Goldstein and Tanner used stages that are usually marked by the recognizable tooth shapes from beginning of the calcification through to the final mature form. This method was later modified by the Demerjen and Goldstein in 1975. Demerjen method involves analyzing the development of the 7 left permanent mandibular teeth excluding the third molar. Each tooth's development is divided into the 8 developmental stage labeled A through H, and these stages are defined as follows. This is A to H. Stage A, cusp tips are mineralized but have not yet coalesced. Stage B, mineralized cusp are fused together. Stage C, enamel formation ends and dentinal deposition starts. Stage D, crown formation is completed to the dento-enamel junction. Stage E, root length is shorter than the crown length. Stage F, root length is at least equal to the crown length. Stage G, root growth is complete, apical ends are open. And stage H, apical ends are closed. Methodology: radiographic assessment. Take a radiograph of the 7 left permanent mandibular teeth. Identify the developmental stages for each tooth. Assessing scores. Each developmental stage is assigned a specific score. The score of each stage are predetermined and provided in a reference table. Then the summing the score. The sum of the score for all 7 teeth, for example 6, 7, 5, 8, 4, 9, 7. So the sum is 46. Then conversion to the dental age. Use a conversion table to convert the total score to a dental age. You can find a conversion table, the standard table in the different articles. So the conversion table is based based on the large population studies and provided the average chronological age for each total score. Assume that a total score of the 46 corresponding to the dental age of the 7 years, for example. Advantages: standardized approach, provide consistency and reliability. Non-invasive, utilize radiographs which are widely available. Comprehensive, evaluates both crown and the root formation. Limitations: radiation exposure, required radiograph. Population variability, accuracy can vary across populations. Complexity, require detailed analysis and interpretation, and the overestimation of the age in some population. The next is William modification. Williams et al. Modified Demajian method in 2001 to improve the accuracy of the dental age estimation in Belgian Caucasian children. The modification involved creating a new table for dental maturity score for the boys and girls, aiming to reduce the overestimation of dental age observed in the Demajian's original method. The methodology: Williams method used the same 7 left permanent mandibular teeth, excluding the third molar, as a Demajian's method. However, it introduced the new scoring system and the conversion table specifically adopted for the Belgian Caucasian children. And the chronologic age is obtained by adding the maturity scores of the teeth similar to the Demajian's method. So take a radiograph of the 7 left permanent teeth, identify the developmental stage, which is A to H for each teeth. Each developmental stage is assigned a specific score based on a new table. Sum the score for all the 7 teeth. Use a new conversion table to convert the total score to an estimated dental age. Advantages: improve accuracy. Williams method has been shown to be more accurate than Demajian's method, particularly in reducing overestimation of dental age. Popular specific: the new tables are specifically adopted for Belgian Caucasian children, making the method more reliable for this population. Simpler application: the method retains the simplicity of Demajian's approach while providing more accurate result. Limitations: population variability. The method may not be as accurate for population other than the Belgian Caucasian. And radiation exposure: similar to the Demajian's method, it requires radiograph which involve the exposure to the radiation. Complexity: although simpler than the sum method, it still requires the detailed analysis and interpretation. Then the Qualls method. Qualls method introduced by a Quall et al. Involving taking x-rays of the front teeth and conducting a clinical examination of the oral cavity. This method is used to determine whether a person is under 18 years of age and to estimate the age above this level. It calculates the pulp tooth ratio for 6 mandibular and maxillary teeth, maxillary central and lateral incisors, maxillary second premolar, mandibular lateral incisor, mandibular canine, and the first premolar. Methodology: radiographic assessment. X-rays of the front teeth are taken to visualize the internal structure of the teeth. The clinical examination of the oral cavity is conducted to assess the oral dental health and development. Then pulp tooth ratio calculation. The ratio of the pulp chamber to the oral tooth length is calculated for each of the 6 teeth mentioned, and this ratio changes as the person ages, with the pulp chamber becoming narrower due to the deposition of the secondary dentin. Measure the total length of the tooth from the apex of the root to the tip of the crown. This is done using the radiograph. Measure the length of the pulp chamber within the tooth. The pulp chamber is the soft tissue inside the tooth where nerves and blood vessels are located. Calculate the pulp tooth ratio by dividing the pulp length by the total tooth length. Then age estimation. The calculated ratios are compared to the established standards to estimate the dental. Advantages: non-invasive. Utilize radiographs which are non-invasive and widely available in the dental practices. Reliable. Provide a reliable estimation of age by examining physiological changes in the tooth structure. Useful for both living and deceased. Can be applied to both living individuals and the deceased remains, making it valuable in forensic cases. Limitation: radiation exposure required radiographs which involve exposure to the radiation. Population variability. The accuracy of the method may vary across the different population. Complexity: requires detailed analysis and interpretation of the radiographs and clinical findings. Ethnic differences: the method may need adjustment for the different ethnic groups to ensure the accuracy. According to Muhammad R.B. et al., accuracy of 4 dental age estimation method in southern Indian population, Nola stage, is more accurate than the Demajian's and the Williams and Havicos. According to the Blanco and V systemic review, overestimation is observed in the Demajian and underestimation observed in the Camrys method. These are the references. If you want this PDF or any other PDF, just like, subscribe and comment your mail ID with the topic and I'll send you the PDF. New videos on Thursday and Sunday. Also, we try to put MCQs according to the topics on our shorts with the answers and the explanation if needed, which will help you in Viva or NEET exam. Like, share and subscribe the channel. Thank you.